Good day, everyone. I am Mashael Alfaifi, critical care clinical pharmacist, and today my presentation about research misconduct and will be focused about the data management. Through my presentation, we'll go through the definition and the prevalence and also consequences of the research misconduct, and also will be discuss what driven the researcher to engage in the research misconduct. And also what we can do if we suspected research misconduct, and also through the end will be go data management. The definition of the research misconduct actually is coming either fabrication or falsification or plagiarism. Fabrication is the making of the data and repeating them. An example like duplicating the survey data or duplicating the patient profile. On the other hand, the falsification is manipulating the research material or equipment or picture or omitting some data or results. Plagiarism, appropriation of another person's idea and process, also results or word without giving appropriate credit. Additionally, there is a lot of things can contribute with the research misconduct, either withholding result or conflict of interest, or also selective citing or selective citing or self-plagiarism, also misusing of the seniority. This is all can lead to research misconducting. On another hand, we have a definition for questionable research practice, but we need to understand the difference. The main difference between the questionable research practice and misconducting research. Questionable, it can be also, we can evaluate either like if omitting outliers, we can evaluate the type of the statistical, also an appropriate research design or conflict of the interest, and also questionable authorship. We need to understand the difference between the questionable and research misconduct. Actually, the misconducting project, it can be directly no meaning for the data or no meaning for the research. Questionable research practice, it can be still in the gray area, but by the end, we need to keep it the gold standard by research integrity. The prevalence of the misconducting research, there is one study in 2021 assessed prevalence. The first outcome was the research misconduct was at least 2.9%, and questionable research was 12.5%. And research witness other who had committed at least one research misconduct 15.5%. While 39.7% were aware about the other can use it at least one questionable research practice. The consequences of the misconducting research, either individual costs, example like lost a job or revoked PhD, brand costs, damage the reputation for the society or for the brand, and capital costs can be legal cost or investigation cost. Human cost can lead to misdiagnosis or mismanagement for the disease in future. Here's some examples I want to discuss through the journey. We have first case. It was in 2015. Done by Biomedical Scientific. They done fabrication and falsifying data in HIV vaccine trial, and they cost the author $7.2 million as funded. On another hand, there is Dr. Scott Ropin. He manipulate or fabricate at least 21 papers, and still the editor of the in chief of the anesthesia and analgesia highlighted the cost of the misconducting in the case for this case, and I cite from his word. We are talking about the millions of patients worldwide where post-operative pain management has been affected by the research finding of Dr. Ropin. So we need here, we're asking ourselves, what can be driven the researcher to do misconducting research? Either insufficient supervisor or career pressure, especially for the academia pathway or research psychology, or also lack appropriate training and the skills, and also adequate knowledge. But what we can do if we suspected research misconducting? Firstly, we need to optimize the communication and no blame culture. We need to understand no if anyone suspected that and the silent and he kept it silent, it will be consequences for long term, especially if the research can be affected a multiple publication later. So the best way it's the highlight the concerns for supervisor or principal investigator or head for the unit or research integrity office. And also always remember that good communication is key for resolving the concerns. But another hand, what we can keep the or avoid the research misconduct. We need to follow up some guideline in term when we conduct the research. Firstly, U.S. federal policy, International Committee of the Medical Journal Editor, and also Committee of the Publication Ethics, and also good publication practice. And this specifically good publication practice, a lot of the research center now, they make the researcher mandatory to take this certificate. If happen research misconduct, how we can evaluate? Firstly, we need to assessment to allegation to determine whether it's fall within the scope of the research misconduct. If yes, we go to inquiry process. Inquiry, we need to gather preliminary evidence, and also we can do interview with the researcher and also the key witness. After that, if yes, inquiry, yes, we go to the investigation process. We need to examination of the research record and evidence in depth. If it true happen a misconduct, we need to reporting this administrative sanctions and notification to applicable parties. Data management, it can be do it to prevent research misconduct. We need to understand firstly the best practice. It need to good data management plan. Specifically, if we have continuous data or we have large data like more than 1,000 patients, here we need to build good strategy to collecting the data. Even if we have multiple participant can be do data collection. We need to standardize the work by file management and data formatting and also data access. Data analysis, it's not we will not keep it until the end of the collect all the data. We can do it in between the study, like a preliminary analysis, a pilot analysis, multiple time, specifically if we want to assess the quality of the collecting the data. Also, we need to do regular meeting with the participants, also collaborative publication, correlating data and metadata. This term, it's mean we make a special statement like vocabulary or make a specific definition, like if you can see SOVA, it's mean how much is this cut point for the score and so on. If also we use different calculator, we need to unify this. On another side, we have also foundation data structure by migrating the data and control the vocabulary, data corrosion and documentation through reorganizing the data every time and cleaning and migrating the data. And by the end, we need good storage for the data for confidentiality, and we can control this data. The data management plan, before we build it, we need to ask ourselves 5 questions at least: what we are creating, how we securely handling the data. It cannot be if we have like multi-center data. We need to unify at least one platform to collect the data. We have a lot of the platform currently to unify the collection of the data. Some of them is from society and specific society, and some of them from the research center. And also we need to understand we need to build specific privilege for how are the access and data integrity maintained for long term, and also what are the role of the responsibility for the participant, and what is the system can be used for documentation. At the end, we need to, I conclude my presentation. The most conducting for the research, it's not only the term of the fabrication and falsification and also plagiarism. It's sometimes it go beyond that to either interest of the conflict of the interest, or bias selection, or seniority during the research. Misconducting can be harm the subject, and it's not body of the knowledge only. Misconducting can also be cutting across the multiple aspects of the research, and that lead to the future misconduct. And when I conclude my presentation by only one terms, when we're starting the research, we need to keep it high research integrity, to keep it the data as maintained wise. Specifically now, a lot of the research now, absolutely, I'm sure, and a lot of the people now handling the research, that will be affect especially the management of the patient, or can diagnosis for the patient. And by this word, I concluded my presentation. Thank you all for my listening, and this is my reference.